Hi, I'm Brenda Power Ahmad, and you are watching OTV, where we offer solutions for living. In this episode of OTV, we are going to talk about another common reason that parents seek occupational therapy treatment for their child. Parents may become concerned if their child displays problems with sensory processing. Sensory processing is complex. However, often there are simple home-based strategies that can be very helpful in meeting a child's sensory needs. One of the most troubling sensory-related concerns for parents is when their child is a sensory seeker, meaning they seem to be constantly looking for additional sensory input. Sensory seekers are constantly on the go as they are attempting to obtain the sensory input that their bodies crave. They may run, crash, jump, mouth items, bounce, or flip to keep their bodies moving. This type of child has what we call a high sensory threshold. This means that in order to feel regulated and in an optimal state for attention and focus, they require much more sensory experiences than others. As a result, they are constantly on the lookout for opportunities. Occupational therapy works with children who struggle with sensory seeking by first identifying the types of sensory experiences a child is seeking, and second, by helping to create more opportunities for sensory input throughout their daily routines. When needed sensory input is provided naturally, these children are able to remain in a more regulated state, reducing the behavior. Generally, an occupational therapist's first step in addressing a child's sensory needs is completing a sensory-based occupational therapy assessment. This assessment can help to outline the behaviors, causes, and possible solutions. Our treatment would then involve specific activities and strategies tailored to the child's unique needs. These strategies are then modeled, monitored, and adjusted as needed during treatment sessions. There are many activities that occupational therapists can suggest to support parents in meeting the unique needs of their child. Everyday activities such as household chores, park visits, and games can be designed in ways that help provide needed sensory input. An occupational therapist will ensure to make the activities fun and a part of the daily routine. The ultimate goal is to integrate enjoyable activities naturally into the child's day, making therapy not seem so therapy, and to ultimately benefit the child and other members of the family impacted by the behavior. In the end, remember that each child and each environment will need a unique solution to any given problem. Seek the services of an occupational therapist if your child needs some extra help. Well, that concludes this episode of OTV. Remember, OT's know stuff.